Hello again. This is Alexandra McDevitt with the Reproductive Health Supplies Coalition. Welcome everyone to our webinar, The Female Condom Landscape, a Total Market Approach. We're really excited about our list of presenters today. Before I turn it over to them, I just want to do one point of housekeeping. All of our attendees are automatically muted today. If you'd like to ask a question, there's a questions box in your webinar pane. So throughout the presentation, you can type out your questions, and we have time at the end where we will go through and hopefully be able to answer everyone's questions. So I will turn it over to Joy Lynn.
Thank you so much, Alex, and welcome everyone. Hi, my name is Joy Lynn Alagarbis, and I am thrilled to serve as your moderator today for our webinar, The Female Condom Landscape, a Total Market Approach. So I am Master Trainer for UNFPA's Condomize campaign. For those of you who may not know, Condomize is a joint program of the United Nations Population Fund and the Condom Project in partnership with UNAIDS and the Condom Interagency Task Team. Now, our goals as a campaign are to remove the stigma associated with condoms and to encourage governments and key stakeholders to provide access not to just any condoms, but to quality condoms when people need them and in places where they actually feel comfortable gaining that access. Now, why is this important? According to UNAIDS, sexual transmission accounts for over 90% of all new HIV infections worldwide. And that's why at Condomize, we believe that condom education is for everyone. So if you are sexually active, then great. You can learn how to best protect yourself and also your partner. Of course, that protects your family and has a tremendous impact on your community. And if you're not sexually active, you can still learn about a condom's life-saving benefits and a condom's benefits even beyond prevention. And you can pass that information on to someone who does need it. And thank you, yes, for this next slide. That's great. So Condomize, oh, sorry, we can go back to the previous, Alex, if you don't mind. Thank you. So Condomize uses arts-based approaches in order to communicate what can often be complicated, evidence-based information and research. So we offer this information in a way that feels approachable and is easy to understand for the end user. Now, this also allows us to encourage dialogue about topics that can often feel challenging to talk about. So for example, male condoms, female condoms, personal lubricants, and sexual activity in general. Next slide, please. Thank you. In my role as Master Trainer for Condomize, my area of expertise, of course, is condom education. So I train trainers at the global, regional, and national levels on several topics. These include the variety of male condoms available globally, so sizes, shapes, colors, textures, flavors, enhanced lubricants, different materials. Of course, I also train extensively on female condoms. Now, those are the female condoms that have achieved WHO pre-qualification and others that are available regionally, as well as those that are up and coming in the global pipeline. I educate trainers about the latest research on personal lubricants and also on additional safer sex supplies. So we train trainers with all of this evidence-based information because they are the ones who are on the ground doing the grassroots work in their own communities. So they really help to make this information contextually specific, developmentally appropriate, and ultimately sustainable. Now, in my experience, the one topic that will stop people in their tracks, that will literally turn a rowdy room silent and focused, is female condoms. This is something that we at Condomize have seen over and over again as we have done female condom demonstrations and offered education in multiple settings around the world. So on the upside, there is a tremendous interest in and curiosity about female condoms from people of all ages, all genders, in a variety of settings worldwide. And it's very evident from my perspective that clear and accurate information, encouraging open dialogue without stigma, and fun, approachable educational training creates demand for female condoms. For me, this is crystal clear. But on the downside, we have seen that there is still a lack of clear and accurate information about female condoms. Myths and misconceptions still persist, and they are sometimes perpetuated by the trainers and the stakeholders who are responsible for offering female condom education or making decisions about female condom procurement. So this highlights a bit of a disconnect. The demand for female condoms and the research is stronger than ever, yet female condom procurement is surprisingly at an all-time low worldwide. Next slide, please. So this webinar was organized to kick off the commemoration of Global Female Condom Day, which is every year on the 16th of September. During this webinar, we hope to explore the answers to the questions we posed in the invitation to all of you. What can each of us do in our respective roles to ensure that female condoms are provided in countries and to programs in a sustainable manner? So today we have 3 distinguished panelists from the private sector, from civil society, and from the government who can offer their perspectives on this question. So first we have Denise Van Dyke from the Female Health Company. She will present the current landscape of female condoms, the state of the global market, and the latest research on availability, cost effectiveness, and impact. Nora Miller from WCG Cares will then share the results from the Expanding Effective Contraception Option Team's 2018 Total Market Assessment for the female condom product category in 2 countries, Malawi and Zambia. And then finally, we have Thato Chidarikire from the National Department of Health, South Africa. She will talk to us about the successful programming of female condoms in South Africa, where partners are working to distribute 120 million female condoms over a 3-year period from 2018 to 2021. So thank you all again for joining us today. And with that, I will hand it over to Denise from the Female Health Company.
Thank you so much, Joylyn, and a big welcome and thank you to everybody who's on this webinar today to help celebrate Global Female Condom Day with us. It's much appreciated. I am speaking from my role as president of the Female Health Company, the manufacturer of the FC2 female condom. Next slide, please. And today what I would like to do, if we could go, yes, to the next slide, is really show you what is the current market overview of the female condom, what are the social and product cases for the female condom, but most importantly, if demand and research are at an all-time high, then why is procurement at an all-time low? And we think that this is due to some of the myths and misconceptions that are still out there. So we would try to show with the research that has been published lately to debunk these myths and misconceptions. If we can go to the next slide. So the Female Health Company provides the FC2 female condom. We were the first company ever to launch the female condom with the FC1 in the 1990s. And then the second generation female condom made out of nitrile, not latex, was launched in 2007. It is US FDA approved and WHO approved and has been distributed to 149 countries worldwide. Apart from the FC2, the female condom as a category, of course, is still the only product available under a woman's control, believe it or not, and offering triple protection against HIV/AIDS, other STIs, and unplanned pregnancy. Next slide. So the female condom is very much framed into the widest possible choice. We want to make sure that men and women have options to choose from, whether it's contraceptives or barrier methods, so that they can find that product that most suits them. Because research shows, and we'll get into that later, that when they find a product that suits them, they're more likely to protect themselves. And that's what we're all about on this webinar, of course, making sure that the number of protected sex acts goes up. So if we look at the UNFPA product catalog, we see that the female condom, just like the male condom, is actually enlisted under the contraceptive category, along with IUDs, implantable contraceptives, the pill. Unfortunately, there's no HIV/STI prevention category, and that might be a point of improvement as well towards UNFPA, because one of the main features of the female condom, of course, as it is with the male condom, is that it offers dual protection, also against HIV and STIs. So that would be great to see changed as well. Next slide. But what does the global condom market look like right now? So when we see the market for male and female condoms in its entirety right now, we have to distinguish between two sides. We have the consumer private market, where the consumer directly purchases the male or female condom from a store or online. And then we have the global public sector market, whereby the user will usually get its female condom through government, donor-funded programs, or NGOs. And then that global public sector market is also divided into a family planning stream and an HIV/AIDS stream. And those funding streams are very much separate from each other still, unfortunately. Now, what is very interesting about this slide is that we see that the consumer market units, as compared to the global public sector units, are roughly the same. We see that there are about 10 billion male and female condoms in the consumer market and around 10 billion male and female condoms in the global public sector market. What also becomes very clear from this slide, however, is that you're not in it for the revenue when you're selling condoms in the global public sector market, because whereas in the consumer market, you would get around $4 billion for those 10 billion units, you can see that in the global public sector market, revenue is more close to $400 to $500 million. Now, when we look at the female condom market, we're nowhere near talking to billions. Actually, the female condom market, which is quite sporadic, ranges anywhere between 30 to 70 million units a year. And that sporadic nature is very much determined by large tenders and whether or not donors have funding to procure the female condoms. So if we're looking at a 10 billion global market for public sector, and female condoms only make up around 30 to 70 million units of that, we're not even talking 1% of all condoms that are being purchased and distributed in global public sector that are female condoms. And that needs to change. Next slide. So right now, we see the main customers in global public sector as well as private sector are UNFPA and USAID, and they procure most condoms, male and female condoms, for the African continent. In addition, we also have governments and ministries of health that procure female condoms directly. As Joylyn said, we're lucky and honored enough to have Dr. Sato with us on this webinar today from South Africa, which actually is one of the largest and most successful female condom programs in the world. And they purchase 40 million female condoms every year starting this year. Brazil is another great example. They purchase between 30 to 50 million female condoms yearly or biannually. And then, of course, we also have our NGOs and CBOs, social marketing organizations, and we shouldn't forget the commercial partners that promote directly to consumers. Now, granted, right now, of the total global market of female condoms, about 90% is for public sector only. But we are rapidly expanding commercial use and sales as well. Some great new developments, for instance, have happened in the US, whereby under the Affordable Care Act that was installed by President Obama, women in the US can now get their female condoms through their insurer and through a prescription without any extra pay. And that is a great opportunity because it takes away one of the thresholds that women have sometimes expressed, which is cost. So that is a great private sector opportunity. In addition, the female health company just also did a good deal with DKT Brazil for 8 countries in Latin America, whereby the FC2 female condom will be launched under the Prudence brand, which is hugely successful with DKT already for male condoms. And so in a couple of months, the Prudence brand will be launched in Chile already, allowing FC2 female condoms to be bought in private sector as well. So we're slowly moving up with the commercial sector too. Next slide, please. Now, right now, there are 4 different WHO pre-qualified female condoms. We have the FC2 female condom, which is made by the Female Health Company. We have our headquarters in the US and the factory in Malaysia. We have the Cupid condom, which is currently being manufactured by Cupid Limited, headquartered and manufactured in India. We have the PATH's Women condom, which was designed by PATH in the US and is actually manufactured by Dawa in China. And then we have the HLL condom, which is or the Velvet, which is manufactured by HLL Limited and also headquartered and manufactured in India. Now, there are some differences between these 4 condoms, even though they're all WHO pre-qualified, and it shows you that the female condom is not the same as the male condom. First of all, what's important to notice is that all of them are WHO pre-qualified. And then in addition, the FC2 female condom is also US FDA approved. So it's the only female condom that can also be sold in the US. Then what we also see is that 2 of these condoms are made out of latex, which is HML, the Velvet, and Cupid. So they have the same features as the male condom would in terms of material only. When we look at the PATH women's condom in the FC2, they've chosen for a non-latex version, which is great for those people who have latex allergies or sensitivities, especially if there are large male condom distribution programs in countries already, which are latex only. So not only does that provide an option in terms of a female-initiated option, it also provides an option for those women and men who are latex allergic or sensitive to it. Now, what this picture also very clearly shows is that these 4 designs are very different. And that's sometimes what's forgotten by the field. They think because male condoms have different manufacturers, it's good to have different manufacturers for female condoms too. And that's true in essence, but all male condoms pretty much look alike. It's the same concept. They might have ribs or different colors, but the concept stays the same. However, with the female condom, we see that designs are quite different. For instance, the Cupid has a sponge instead of an inner ring, and the PATH women's condom is actually rolled up, which this picture doesn't show so well, and has a dissolving tip, which makes insertion different, kind of like a tampon. So you insert it, the tip dissolves, and then the condom stays in place. So what we need to be very careful of, and I know Nora Miller will address this in her presentation later on as well, is that every female condom is a very different type, and they all need their own education. So just because there's been education on one type, it does not mean that people will know how to use the other type or that they will be automatically comfortable with it. Next slide. So why female condoms? Again, it's the only female-initiated method that provides that triple protection. We see from research, and we'll show which research, that if you have both male and female condoms in the market, it leads to more protected sex acts. And in addition, it's very cost-effective. It has a positive return on investment. Next slide, please. So right now, what we see is that the #1 cause of death globally for women aged 15 to 45 is still HIV. And 80% of female cases are still contracted via heterosexual transmission, which Joylyn also alluded to already. And male and female condoms are still the only prevention products available right now. Next slide. So if we look at that social case for female condoms and we involve the dual or triple protection female condoms offer, we see that we can even go further with this. We can empower women by the use of the female condom to decrease maternal mortality and fewer unwanted pregnancies and protecting them from HIV infections and other STIs. And I know the audience of this webinar knows these numbers by heart. It's what keeps us awake at night and makes us go to work in the morning, because we still have 215 million women in the world who would like to have access to contraception but don't, which leads to 21.6 million unsafe abortions each year, which causes 5 million women to be hospitalized each year, and that in turn accounts for 13% of maternal deaths. Worldwide, as we've seen, women and girls still account for slightly more than half of all HIV infections, and in sub-Saharan Africa alone, 23 million people live with HIV/AIDS, of which over 12 million are women, and nearly 2.5 million are children. So it's clear that we're not serving these populations yet with the contraceptive and barrier methods they need. Next slide, please. So then what is the product case? Let me start with the product case for the FC2 female condom first and go into the product case for the female condom in its entirety next. First, the FC2 female condom is the only FDA and WHO approved female condom, which is as a result approved for bulk procurement by UNFPA and USAID, but also commercial sales in the US. It has this non-allergenic material as opposed to the latex male condom because it's made out of nitrile. And nitrile holds many benefits. Like I said, it can be used by people who are latex sensitive or allergic, but it can also hold both water and oil-based lubricants, while latex condoms tear when oil is applied. Because it's non-allergenic, it can also be inserted hours in advance, and so that arguments that condoms ruin the moment, which so many men and women like to use an excuse to not use a condom, doesn't really apply with the female condom anymore. And the good thing about nitrile also is that it transfers body heat. So it ensures a more natural sensation for the women and men who use it. And we all know that if it feels more pleasurable, people are more inclined to use the product as well. The FC2 has been distributed to 149 countries worldwide. It's the most known female condom. And the Female Health Company has been engaging in public-private partnerships for the last 20 years now, providing backup support in terms of IEC materials and training through our own master trainers worldwide, free of charge, so all on our expense. Next slide, please. What we also see right now as a product case for the female condom in its entirety is that a lot of women are also looking for a hormone-free option as a contraceptive. Especially in Europe and the US, we see that women are becoming more critical about the side effects that some of these hormonal contraceptives might have. And obviously the female condom is a hormone-free contraceptive option. What we also see is that it's a preferable alternative to a male condom, according to males, and we'll back this up with research in the coming slides. Because men don't have to wear it for a change. One night he can wear a condom, the next the woman can, and it's not as tight and restricting around the penis as it is for a male condom. In addition, it can be inserted in advance of sexual activity. Next slide, please. So we see right now that there is a huge lack of availability for the female condom, which is enforced by myths, unfortunately. And we'll go through these 4 myths to debunk them. Myth 1 is it's too expensive. 2, there's no demand. 3, we already have male condoms and larks, so the female condom is not necessary. And 4, men do not like the product, and without them, it will never succeed. Next slide. 1, it's too expensive. This is so false and very much hints towards short-term thinking. The business case for female condoms done by Global Health Visions in 2014 actually shows that there's a huge return on investment for female condom procurement through 2 ways. And these 2 ways have an effect on the overall economic growth of a government or a country. 1, investing in female condom procurement ensures cost savings to the health system because you're focusing on prevention instead of treatment. And I don't have to tell this audience that prevention still is much cheaper than treatment. A condom is cheaper than an ARV. 2, economic productivity losses are averted because more women are able to join the workforce. They're not sick or pregnant, and they can finish school and actually get a job, which also adds to the overall economic productivity of a country. Next slide, please. So what does that relate to in monetary value? What this study shows is that for every 1 million female condoms procured in these countries, every $1 spent on that in Kenya gave a return of $1.94. That's twice the return on investment. In Nigeria, for every $1 they invested in procuring female condoms, they saw a return of $3.20. Which is triple the investment. Any investor would see that as a great investment. And that is just a monetary return on investment. What we also saw in this research is the health impact. For instance, for every 1 million female condoms that was procured in Kenya, 125 HIV infections were averted. And for every single million female condoms that was procured in Myanmar, 521 unsafe abortions were averted. Next slide, please. The second myth is there's no demand, which is false. There was a recent Uruguay study in 2017 done by UNFPA Uruguay and the Ministry of Health in Uruguay that really looked at how do average women perceive the product. And for the first time ever, they didn't look at key populations, but they really wanted to know what does the average woman on the street in Uruguay think of the female condom. And they used the FC2 female condom for this study. And there it shows very clearly, 77% of women said it was very good. They cited greater comfort and practicality and greater protection as the main advantages of the FC2. And even better, 81% said that they would continue using it in the future, which is what we all want, because that means sustainable programming and the decreased number of unprotected sex. More importantly, 64% said that they experienced no difficulties at all. And usually the no demand myth is supported by it's difficult to use. So the fact that 64% said I had no difficulties whatsoever was very, very crucial to see. Now, the South Africa National Female Condom Program evaluation included an evaluation of the National Female Condom Program done by Match Research, one of the most renowned research institutes in South Africa. And they did a 2-year study on the female condom program in South Africa. And again, we have Dr. Sato on this webinar who has even more information on it. And they show that actually 80% of women felt that the female condom put them in charge. In addition, and this is the most important point I want you to remember of this whole presentation, the level of unprotected sex declined from 43.3% at baseline to only 8.4% at 12 months after the female condom was introduced. So this again shows that you need both a male and female condom in the market if you want the overall number of unprotected sex acts to go down. Next slide, please. And here we see women in Chile actually protesting because they want the female condom now in their country, speaking of demand from the grassroots. And I'm happy to report that they were very, very successful, Condom Femenino Ahora, because the government actually procured female condoms ahora. So who says that women can't fight for what they want? They actually brought the female condoms to their country. Next slide, please. So one of the major myths is we already have other commodities. The Amsterdam Institute for Global Health and Research did a study in Mozambique, and there they actually saw that when they introduced the female condom to the market, there was no effect on the other barrier methods such as male condom or contraceptives in the fact that their use went down. In fact, use of other barrier methods and contraceptives actually slightly increased when the female condom was included. So this research very much showed that men and women who weren't using a product before now found something that they could use, and that, you know, having choice available in a market actually has a positive effect on all the products in the market. And again, the South African National Female Condom Program evaluation showed that of the current female condom users, 73.4% reported using condoms in general more often than before they started using the female condom. Next slide, please. And then finally, my favorite myth. Men do not like the product, which is false. Again, the South African National Female Condom Program evaluation showed that at their 1-month interview, 58% of men said that the female condom was better or much better than the male condom. And in 12 months, this actually rose to 74% of men. What is also great when it comes to negotiating condom use is that this research showed that at 6 months into the research, 97% of women reported that their partners were supportive of using the female condom. Next slide, please. So for some reason, demand is at an all-time high. Research is stronger than ever. There's a clear need for the female condom, but procurement is the lowest it has been in the last 10 years. And this should not be the case. So our call to action right now is make sure that we lobby for availability. Demand and supply should always match, because 1, we've seen that female condoms provide a return on investment. 2, female condoms are in high demand with both men and women, average and key populations. And 3, female condoms increase the overall use of barrier methods and contraceptives, and that in turn enforces a decrease in the overall number of unprotected sex acts. Thank you so much. I'll take questions at the end of the session.
Great, thank you so much, Denise. So I feel like really the key takeaways, you know, as you stated at the end of your presentation, are not only the high demand for female condoms worldwide, but that female condoms not only provide a return on investment, they also increase the overall use of barrier methods and contraceptives. And that, of course, results in a decrease in the overall number of unprotected sex acts. I think this is fascinating evidence-based information. So thank you again. A friendly reminder to everybody, please type in any questions that you may have into the questions tab. We're happy to answer anything that we can. We do have 3 incredible experts from different sectors around the world, so please do take this opportunity to ask any questions that you may have. So with that, we'll turn it over to Nora Miller at WCG Cares. Thank you, Nora.
Great, thank you so much. Hi, everybody. I'm really excited to be here and part of this conversation, so thanks for tuning in. What I'm going to talk about today is an assessment that I conducted as part of the Expanding Effective Contraceptive Options project led by WCG Cares, which was an assessment of the total market for female condoms in Zambia and Malawi. Next slide, please. So just a quick overview of what I hope to cover in a very short amount of time is the results from our female condom assessment. We used the Female Condom Program Pathway as our framework for guiding this work. And we conducted the assessment in Malawi and Zambia from June to August of this year. We have a final report forthcoming, so I'd encourage you all to keep your eyes open for that as soon as it's ready in the next couple of weeks. Next slide, please. So as Denise said, we're sort of preaching to the choir, all of you logged in today to talk about female condoms. But as we all know, female condoms are the only available method currently that is woman-initiated and offer triple protection against HIV, STIs, and pregnancy. And that's our very important method within the method mix at country level and globally. Next slide. Denise has also covered much of this information about the 4 brands that are currently WHO pre-qualified. However, I'd just like to point out the contrast between the number of condoms in the male condom sphere that have achieved pre-qualification versus the number that are available for female condoms. So we have 4 female condoms currently available by WHO PQ. And in contrast, 31 male condoms have been pre-qualified to sort of frame our thinking in that way. Next slide, please. Great. So a total market approach is a process or a lens that we can use to develop strategies for increasing access to health products and services that are important. And applying this lens to female condoms gives us information that can help stakeholders both within countries and globally to improve coordination and to better target resources for this product. As many of you on the phone know, there are a number of different tools and frameworks that are already available to help assess the total market for reproductive health products. However, for this assessment, we adapted the Man Global Health Condom Program Pathway, which was designed specifically to assess market functions that support condom programming and whether or not they are supporting a healthy condom market or whether or not they might be failing and need more help. So the condom program pathway focuses on 3 major functions. Those are stewardship, program development, and program outcomes. And these functions are critical elements of a healthy condom market. Within each of these functions, there are several subcategories that I'm going to walk through in more detail when we look at the results of our assessment. Next slide, please. So in order to conduct this review, we started with a desk review of literature and a large number of national planning documents. And between June and July of this year, we conducted in-person interviews in Malawi, Zambia, and globally. We're very grateful to everyone who participated in this effort as we learned a lot about the state of the market for female condoms in each country, as well as some of the challenges that implementers, donors, and partners face in keeping the female condom sort of at the table. Next slide, please. So I'll walk you briefly through the Malawi findings. Next slide. Starting with a timeline, so an overview of the history of the female condom in Malawi. So in 2001, the FC1 launched with support from UNFPA with a relatively slow start as there was no clear strategy in place for generating demand for the product. However, in 2004, UNFPA repiloted and focused really on provider training and supporting healthcare workers in counseling and provision. At that time, UNFPA noticed that healthcare providers were really not that successful in promoting the product, but it was the frontline workers that were really pushing it forward and connecting to end users. So with that in mind, UNFPA partnered with the Hunger Project, as well as a female health company, to move the product into rural areas. And this was part of an integrated lifestyle program that really increased demand for the female condom and was greatly successful in reaching end users for this product. In 2008, the FC2 launched in the public sector, as well as a socially marketed program through PSI under the brand name of CARE. And then more recently, there have been a number of different products that were added to the method mix. For example, there was a condom program to support Cupid, led by JICA, which targeted forestry workers in the northern region, as well as commercial sex workers. The EECO project, which I was a part of, launched from 2015 to 2018, the Whisper Women's Condom, which was developed by PATH in 3 urban areas in the Longway, Blantyre, and the Zuzu. And we see from the 2015 to 2020 national strategy that there is actually a pretty significant focus on total market approaches and a focus on female condoms in particular. Next slide, please. Great, so taking a look at the state of the female condom market generally. So within the public sector, there has been the FC2 on the market, as I said previously, since 2008, and there's a range of procurement that takes place from 250,000 units per year up to 1 million units per year during sort of the heyday of the female condom, when there is a targeted strategy between UNFPA, the government, as well as the Hunger Project. In the social marketing category, there is the CARE FC2, which is sold through PSI. Sales have been somewhat volatile over the years, but are still a significant contribution to the market. The Whisper Female Condom Pilot Program, the Whisper Women's Condom Pilot Program through WCG Cares and PSI, was limited to Mzuzu, Blantyre, and Lilongwe, and as I said, took place from 2015 to 2018. And as I mentioned, Cupid has also joined the method mix more recently, and encouragingly, UNFPA has decided to procure 600,000 Cupid condoms due to the success of that program. I should note here that there is no unsubsidized product of FC2, so no commercial sector. Next slide, please. Great, so as I mentioned, our framework for assessing the total market relied on the Man Global Health Condom Program pathway. And under the major function category of stewardship, we have several subcategories that are important for supporting a stewardship function. The first of which is leadership and coordination, as well as program analytics, financing, policy, and regulation. And there will be more information on this in the report, so I'd encourage you all to go and read it if you're interested. However, I wanted to note that for Malawi, we actually see an encouraging amount of coordination and leadership within technical working groups, focusing on both the total market approach as well as including female condoms in the agenda. So the national government decided that anywhere they mention male condoms, female condoms should be mentioned as well. We see a number of challenges in terms of program analytics to assess condom use behavior at the population level. And so this makes forecasting challenging for implementers and decision makers, both within the social marketing sector as well as the national government. However, there are new initiatives in place, for example, through the Palladium and HP Plus project, to create dashboards to track both male and female condoms that should allow more visibility into what's happening in real time. In terms of financing female condoms, there is a limited investment across all sectors, both in supply as well as demand generation. National funding is aggregated within HIV prevention and family planning data, so it makes it difficult to track inputs for product-specific methods and to see what's working and what isn't with regard to funding female condoms. Next slide, please. In terms of program development, we have 2 major subcategories to support this market function: supply and demand. In terms of supply, condoms are provided free within the public sector. However, there have been major challenges in terms of maintaining stock levels, specifically related to reporting stock levels and placing emergency orders. And as I mentioned, some of the initiatives that are taking place now should improve access to real-time information, such as the HP Plus project. There's only one socially marketed product sold by PSI after the end of the EECO project in 2018. And there's no commercial sector supply of female condoms at the moment. In terms of demand, I mentioned earlier the efforts of the Hunger Project to increase demand among rural women by incorporating the product into their integrated livelihoods approach. That was an extremely successful effort at increasing demand. We also saw that UNFPA was successful in working with frontline health workers, such as community health workers, to promote the product at clinic level to providers. However, there's just a general low demand for female condoms currently in Malawi and the need for greater investment. Next slide, please. In terms of use behavior, as I mentioned before, as this is sort of coupled with program analytics, there's very little information of how the female condom is being used and who is interested in the product. We need to invest more in research in this category. When we look at equity, it's important to think about who has access to the product and how can we encourage anyone who wants to use the product to gain access. We don't have a lot of data on this in terms of female condoms, but male condom programs show that there are significant differences in terms of use by wealth quintile, geography, level of education, et cetera, with more urban, wealthy, and educated men and women using condoms. With regard to sustainability, female condoms are currently entirely reliant on domestic funding or foreign aid, and so they're unlikely to reach full cost recovery in the near future. Next slide, please. I may have to hurry along through the Zambia results, so I apologize for going at a speedy pace, but I encourage you to all read our report if you're interested in pursuing this further. Okay, next slide, please. Great. So with regard to Zambia, the female condom has been on the market for a little bit longer than it was in Malawi, starting in 1995 in the public sector, and shortly thereafter joining in the social marketing sector through PSI. Some key projects that have taken place over the years include the PRISM project, the Condomize campaign through UNFPA, and the EECO project more recently launching the socially marketed Maximum Diva condom. Next slide, please. Okay, in terms of the state of the market of the female condom in Zambia, there were recently 3 brands on the market for recent years. There was the FC2 in the public sector, ranging in procurement from 1.5 to 3 million condoms per year. In the socially marketed sector, we have the CARE FC2, which was distributed through Society for Family Health and has since ended distribution, as well as the Maximum Diva, which was distributed by Society for Family Health and WCG Cares under the EECO project and is scheduled to end this year as well. There's no commercial sector product available, and after September 2018, there will be no socially marketed product available. Next slide, please. Looking at our function of stewardship, we see that there is a growing interest in total market approaches. However, national documents have no strong plan in place for how to implement or monitor a total market approach. Similarly to Malawi, we see issues in terms of program analytics and understanding what's really happening on the ground with our key populations of interest. However, there's a bit of data coming out from the Population Council on Key and Vulnerable Populations that estimates the size of key populations such as female sex workers and men who have sex with men that may be able to support our decision making in terms of targeting programming. With regard to financing, there is no currently donor-funded social marketing platform supporting female condoms. Female condoms are not featured as a budget line item, but are aggregated in broader reproductive health finance decisions at the national level. And there's a threat of a potential funding gap for reproductive health commodities for 2018-2019. Next slide, please. So in terms of program development, supply and demand, there was a study conducted in 2014 by the National AIDS Council that found that low availability was a factor contributing to low use of the female condom. While they are provided for free at health posts, not everyone knows where to find the product. As I mentioned, after 2018, there will be no socially marketed female condoms available, and there is no commercial sector for female condoms in Zambia. With regard to demand, we see similar challenges in Zambia that we saw in Malawi. There's a low awareness of female condoms. There's also a challenge in terms of accepting female condoms among females due to stigma, lack of negotiating power, particularly for young women who have older partners and may lack confidence in how to use the product. So again, highlighting here the need for investing in demand creation. Next slide, please. The challenges that we see in terms of use, equity, and sustainability in Zambia are similar to what we see in Malawi. With regard to sustainability, I would just want to highlight a difference here, which is that there is no socially marketed brand available in Zambia after 2018, so there's an urgent need to diversify the female condom market outside of free distribution and to enable subsidy to reach farther. Next slide, please. I'm going to quickly breeze through our recommendations. Next slide, please. First and foremost, we encourage everyone to assign a female condom champion. The experience in Malawi from 2004 to 2010 or so shows the potential for growing the female condom market when there's coordinated advocacy and investment. Next slide, please. Second, we should not assume that all female condom users are the same. we really don't have great information about who's accessing the product and how they're using it. Is it men? Is it women? What age women? What level of education of women? We need to invest in market research to segment the market and allocate resources more efficiently. Next slide, please. Demand generation is critical, and it shouldn't be addressed with short-term one-off interventions. This needs to be a long-term strategy towards building this overall product category. Next slide, please. In conversations with stakeholders, we found a number of interesting opportunities to leverage platforms for family planning and HIV prevention that are a great opportunity for female condoms to be integrated into each of these different program arms. Next slide, please. And finally, I just want to end on this note of encouraging us not to think about male and female condoms as the same product. These are inherently different and face different challenges in terms of growing them and sustaining the market. So female condoms shouldn't be compared to head to head in terms of market volume, cultural barriers to use, demand generation strategy, or supply forecasting. However, we see that in Malawi, it is encouraging to have a strategy such as including both male and female wherever the word condoms is used, to keep condoms on the table and to keep the conversation going about this product. Next slide, please. And I'll just end by thanking everybody who is part of this effort. We look forward to sharing the report with you soon, which goes into much greater detail. And I apologize for going over time. And thank you for your attention. I look forward to answering questions later.
Thank you so much, Nora. So I found the historical timeline for female condoms in both Malawi and then again in Zambia to be a really interesting map with regard to programming in each country. And I do, as a trainer, I want to re-emphasize your recommendations based on your experience in these countries. So again, assign a female condom champion, do invest in demand generation, and also leverage existing platforms for family planning and also for HIV prevention. So thank you again, Nora, for sharing that with us. And thanks to all of the participants here for sharing your many questions in the questions box. We are running a little bit short on time. So I think what we're going to do is send a questions report with written responses to the questions after the webinar. So do please keep those questions coming. And with that, I would like to turn it over to Thato from the National Department of Health, South Africa, to share her presentation with us.
Hi, good day. I'm Thato Chidarekere. I'm the Director for HIV Prevention Programs in the National Department of Health in South Africa. Next slide, please. Next slide. Right, thank you. The benefits of condoms have been discussed throughout all the presentations, so I won't really go too much into that. However, South Africa has one of the largest national level public sector program procurements per capita globally. The program is relatively well established, and government actually procures the condoms within a ring-fenced fund from National Treasury. Female condoms are also quite widely distributed within all the healthcare facilities and other institutions beyond healthcare facilities, as well as organizations, to make sure that access is wide and broad. The department, as I've already said, procures on domestic funding, which is one of the advantages for the sustainability of the program within the country. And again, the goal of the condom program is to ensure that all sexually active persons are motivated to use condoms consistently and correctly. Next slide. Next slide. Right, so history of the South African female condom program. In 1995, there was a policy decision in the country to provide public sector access to female condoms. And then again, through an established STI program in 1998, we launched a formal phased-in female condom introduction program. In accordance to this, it was actually recommended that the condom program will be implemented within the reproductive health strategy, as well as the contraceptive policy, which is promoted for dual protection. So the female condom is promoted, and the male anyway is promoted for dual protection. Next slide. We're looking at the procurement in the last 10 years for the female condoms, and we'll say that in 2008, we procured, again on domestic funding, as South Africa really procures over 80% of the country's condoms within the total market approach. We distributed just over 4.2 million condoms in 2008, just about 10 years ago. And today we distributed, today meaning like in 2018, or rather 2017 into 18, we distributed just over 21 million female condoms. And in the newly awarded tender, we will be distributing 40 million condoms on an annual basis for 3 years, so 120 at the end of the tender. Next slide. Next slide, please. The decision to actually expand the female condom programming was basically the demand on the ground in terms of female condom being, more preferred, especially within the women that are actually feeling empowered. So again, what did the country do? Because, irrespective of the procurement being increased, we would still find out that there'll be some reports here and there that were saying that use is not as increased. And as we went in as government to try and respond, we got support through our partners, particularly UNFPA, through the implementation partner, Society for Family Health, and embarked on a perception study, just collected qualitative data to find out what exactly is the challenge. And then it was confirmed that there is a need for more education and for promotion. And again, the department then embarked on development and finalization of a condom communication strategy to make sure that as we demand, as the demand increases, the supply also increases, and accompanied by communication. Next slide. Right, I've spoken about the support that the department is getting. In terms of technical support, we get most of our technical support from UNFPA and WHO. And here we try to respond to public demands through perception studies. And one of our most recent perception study actually responded to, or rather directed us towards, the implementation of now rebranded female condoms, as well as including color and scent within the female condom. And then again, this will be distributed in contact and again, together with the condom communication strategy. So our female condom is going to be rebranded and it will be called Maxima. Again, as we already have our male as Max, so the female condom is going to be called Maxima. And again, it is basically to ensure that we're looking at maximum quality, maximum safety, maximum basically everything, I must say. So we also have a condom programming forum, which is part of our support, and this is made of our provincial coordinators, our implementing partners, as well as our technical partners. And implementation is also supported by our partners, as we don't just implement or distribute through the public health facilities, but we also go beyond. And this kind of distribution is supported by our partners. This is just a result of the perception study of what we were looking at. How should condoms be? They should be colored, they should be rebranded, they should actually be scented so that we mask the latex or the rubber smell. So this is what we actually tried to respond to when we rebranded our female condom. Next slide. The brand Maxima was actually chosen following a consultative process, as I've already said, perception studies. And this brand was chosen basically because it conveys messages about making a responsible choice to protect oneself and others. The dual nature of the condom has already been discussed. And again, with this branding, in terms of total market approach, it was to ensure that the Maxima government distributed condom is put on par with our other condoms in the market, for example, the social market, Lovers Plus and Trust, as well as commercial brands such as Contempo, Durex, and so on. And again, we procure lubricant, which is also branded Max, and we could procure it in conjunction with both the condoms that government distributes in the other public health facilities and beyond in the non-traditional sites. Next slide. Then I spoke about domestic funding in terms of our condom program. So the National Department of Health usually puts together a 3-year national tender administered by the Department and National Treasury. And this is usually funded through a ring-fenced conditional grant. And as I said, over 80% of condoms are distributed by government. And in this tender that has just been awarded just a few weeks ago, the female condom target really would be to distribute 40 million. This is double what we distributed in the last financial year. 40 million female condoms per annum over the next 3 years, which will give us 120 million condoms at the end of the tender, and with a little 20 million per year, which will give us 60 million at the end of the year. So again, we have advertised, we have awarded, and we will be ensuring that implementation takes place in conjunction with training and mentoring to ensure that everybody who chooses or who uses the female condom has enough communication, has enough training and empowerment to ensure that they use the female condom as per the demand. Thank you. Next slide. Next slide, please. We have different female condoms in the country, and I think that has already been discussed by many. However, within our current tender, we'll be distributing the FC2, the Cupid, and the HLL. Next slide. This talks to contracting, where we have contractors of both male and female condom. We also support local manufacturing. We have about 260 primary distribution sites. So it's a very big program. Primary meaning the first point of contact from the supplier. And we have just over 3,000 non-traditional sites, which are secondary distribution sites. And we also we go beyond to try and go to hair salons, for example, spas, shops, garages, to ensure that everybody who actually needs a condom can actually access a condom. I mean, we do have some challenges here and there, but we're trying to make sure that access is actually expanded within the country to make sure that everybody is empowered, particularly with the female condom. Next slide. Again, in terms of supporting implementation, the department has developed a distribution plan. And the main objectives of this condom distribution plan are really to ensure that we support demand, we support supply, we ensure that we have high quality condoms, and then the monitoring and evaluation. And through this, we have other implementation through the districts in all our 52 health districts in the country throughout the 9 provinces. Next slide. So the main success is basically due to the fact that we let the provinces own the programs. So in terms of monitoring, the supplier stock is monitored within the DOH as well as the National Treasury at the beginning of each year, and as well as on a quarterly basis and every 6 months. But on a monthly basis, we try to check what is happening as distribution occurs so that we can identify first early warnings and then support where we need to. We monitor the primary distribution sites. There's a link to the LMIS within the DHIS, and these are our data systems. And then again, as we've said, our implementation plans have already been discussed. We have a technical working group through the National Condom Forum that actually works with the condom program to ensure that we actually have everything that we need. We have a training program as well, where again, we have actually included in this tender that all the female condom suppliers should actually provide training. And we have had a lot of support from female health company in terms of training throughout the country within the public health facilities and outside. So we're trying to get the same training with, again, Cupid, as we are distributing Cupid as well, and we'll be lobbying in the HLL as well as we move into the implementation. Thank you. Next slide. In conclusion, we do realize that we still need more quantification studies to be commissioned to make sure that we inform policy. We need a lot of perception studies as well, acceptability studies, to make sure that, again, we inform policy in terms of the fact that we have increased our procurement with the female condoms, as again based on the data. We have actually rebranded, we have scented, we have colored our condoms. That was based on studies. And again, we continue to provide capacity building to make sure that everybody knows how to use a female condom, as it was also cited as one of the barriers that we need to make sure that everybody gets trained. And then we keep strengthening the marketing and demand creation. And again, we need to make sure that as government, while we are aware of the new female condom developments, we only really distribute those that are WHO UNFPA approved. And those are the ones that we provide in bulk, and those are the ones that we provide through the National Condom Program. So we feel that some of our successes have been through the ownership, the ability to sustain the program in terms of procurement, in terms of capacity building, and in terms of communication. Thank you.
Thank you so much, Thato, and thank you to all of you for hanging in with us here. I know we're a few minutes over time. Thato, it was great to hear about the successful programming of female condoms in South Africa and to get your perspective on best practices as one of our government colleagues. So I just wanted to emphasize one point in the background information that you provided to us, that a need has been identified for better condom marketing and promotion to increase demand and prevent new infections. I wanted to highlight that because I'm certain that this is not only true of South Africa, but also for a variety of settings around the world. And this goes back to Nora's points about female condom champions, investment in demand generation, and leveraging existing platforms, and also to Denise's point about the overall, the importance and the important role that female condoms play in helping to increase the overall use of barrier methods and contraceptives and decrease the overall number of unprotected sex acts. So again, thank you so much for your participation. Thank you to everyone who's joined us today and for all of your questions. We are keeping track of them. And we will send a questions report with written responses to these questions after the webinar. So we look forward to commemorating Global Female Condom Day with all of you, again on Sunday, September 16th. And thanks especially to the Reproductive Health Supplies Coalition, the NERT Caucus, Alex and her team for all of your support. And with that, Alex, I'll hand it back to you to finish us up.
Great. Thank you everyone so much for these great presentations. As Joy Lynn noted, we will be taking in everyone's questions. As we've gone over time, we won't have time to answer them live, but we will send out the responses through the appropriate channel. So thanks so much everyone for joining, and I look forward to continue this work together.
Sure, thank you.
Thanks, everyone.
Thanks, everyone.
Thank you.
Thank you very much.